Understanding and using your CDC Worksite Health ScoreCard results. This tutorial will provide information on understanding and using your CDC Worksite Health ScoreCard results. Once you complete and submit your CDC Worksite Health ScoreCard, you will have access to your results and a variety of reports. The reporting features of the ScoreCard system are among the best reasons to create and use your ScoreCard account. You not only have access to your scores, but the opportunity to generate and use reports for planning and evaluation purposes. To help illustrate the reporting features of the online CDC Worksite Health ScoreCard system, we will follow the fictitious employer, our healthy company, as Employer Administrator Jane B. Well and team member Steve Hart review worksite results. An employer account must have at least one worksite in order to access the CDC Worksite Health ScoreCard. As this chart shows, our healthy company has 3 worksites, and each has a scorecard associated with it. Viewing scorecard results from the employer dashboard. In this example, 2 of the 3 worksites for our healthy company have completed their scorecards and have reports ready for viewing. The employer administrator can access all reports from the employer dashboard seen here. On the right side of the worksite box, the worksite reports column has 3 types of auto-generated reports listed. Clicking on the report name will open that report for that worksite. Now, let's look at the reports individually. The summary benchmark report shows the scorecard results by topic. On the left side of the table is the topic name. Next to that is the listing of the total points possible for each section. The next 2 columns are the West Coast Division scores for the past 2 years. The green and red arrows indicate where scores increased or decreased from the previous year. The remaining 3 columns are the benchmark data that show the West Coast Division compared to other worksites in our healthy company, other worksites in the scorecard database of similar size, and all other worksites that submitted scorecard data. As you scroll down the page, you will see a bar chart of the benchmarking data that can be displayed by overall score or by topic. The reports can also be easily downloaded to Excel or PDF formats. Next is the detailed benchmark report. The detailed benchmark report shows, by topic, the worksite's answers to the questions and point totals. The scores given for yes responses are 1 point if the question represents a good practice, 2 points if the question represents a better practice, and 3 points if it is a best practice for health promotion interventions based on evidence and health impact. The table includes the West Coast Division's scores for the past 2 years. The 3 columns to the right are the benchmark data. The columns show the percentage of other worksites that answered yes to the questions. You can generate detailed benchmark reports for any topic by using the drop-down menu and then exporting your report by clicking the Export to Excel link. You can return to the employer dashboard by clicking the company name at the top of the page. Next is the Interventions in Place report. Clicking here will take you to the Interventions in Place report. This report allows the worksite to see how many of the interventions are currently in place. The chart on the left gives an overall view of the interventions rated good, better, and best. In this example, the West Coast Division has 25 out of 53 best practices in place for all health topics. The colored area indicates the number of interventions in place. The lightly gray shaded area indicates the number of strategies that are not currently in place or the number of questions that were answered no. The chart on the right is a breakdown of good, better, and best interventions by topic. For accounts with multiple worksites, employer administrators like Jane B. Well can access the Scores for Employers report to view side-by-side comparisons of multiple worksites in their account. Viewing results from the Worksite dashboard. From the Worksite dashboard, team member Steve Hart can see the scorecard results and access the summary benchmark report. In addition, Steve is with the West Coast Division, but he can view the East Coast Division's scorecard and summary benchmark report as well. Let's take a closer look at additional results that can be viewed from this scorecard. The numbers to the right list the total points scored for each topic. The blue shaded boxes to the right of the point total illustrate the points scored for each topic. In this example, Steve answered yes to most of the diabetes questions and scored 9 out of 15 possible points. The blue bar is more than half shaded to indicate that they received more than half the points. At the bottom, you can see that this scorecard received 148 of 264 possible points. By clicking on a topic from the dashboard, Steve can view his answers to the questions and the associated point value. The radio buttons that allowed Steve to answer the questions have been converted to show his responses and the number of points received by question, with the total at the bottom of the screen. Using the scorecard results for planning. In both the summary and detailed benchmark reports, there are links to a resource list called Resources for Action. Click the Resources for Action link at the top, or click on the blue eye icon next to each topic to view the document. This document provides additional resources and information such as articles and toolkits for each of the scorecard topics. You can also download the document by selecting PDF from the Format drop-down at the upper right side of the document. Here are some of the ways your CDC Worksite Health ScoreCard results and reports can be used as a planning tool. Complete the scorecard annually to document and report progress. Review your scores to identify potential program gaps. Use your scores to select strategies to use and set priorities. Identify which of your priority strategies are feasible for short-term or long-term success, and share your scorecard results and reports as a way to inform others about the program's impact. This concludes the tutorial on understanding and using your Worksite Health ScoreCard results. If you have questions or need assistance, please contact us at this email address. Visit our website to access the CDC Worksite Health ScoreCard User Guide for more information.